In the late 19th century, at a time when Taiwan was infested with infectious disease epidemics, Dr. David Lansborough III and Reverend Campbell Moody landed in Zhanghua after a long journey across the vast ocean. Driven by ardent idealism, they opened a church that doubled as a clinic in 1896. Thus began their practice of medical evangelism, to which Dr. Lansborough dedicated the rest of his life. In 1928, in order to save a seriously sick young patient, Dr. Lansborough removed strips of skin from his wife Marjorie, who readily volunteered without hesitation, and grafted them onto the child's wound. This skin graft of love story has since been told to this day and has continued to inspire the entire medical staff at Zhanghua Christian Hospital. In 1952, Dr. David Lansborough IV, along with his wife, inherited his parents' calling to proclaim the love of God and settled in this land. Under them, Zhanghua Christian Hospital grew into a modernized teaching hospital. From Zhanghua, the Lansborough second hometown, words about this remarkable family have spread far and wide. The father and son, paired with their wives, have won the unanimous respect and recognition of the Taiwanese people in every stratum, in every country. Committed to internationalization, CCH has received several international accreditations. In 2008, CCH passed and received accreditation for meeting the highest standards in international hospital evaluation from the JCI, Joint Commission International, and in 2011, again with the same brilliant performance, CCH was awarded JCI accreditation for the second time. The Department of Genomic Medicine, Center for Reproductive Medicine, Department of Laboratory Medicine, and Department of Pathology have all received accreditation from the College of American Pathologists, CAP, the largest accreditation institute in the United States for clinical laboratories worldwide, and the accreditations were successfully extended in 2012. The quality of our lab work has reached international standards. Service Courtesy at CCH was awarded the Quality Services Authentication of TÜV Rheinland, Germany, thus affirming CCH's attainment of excellence and international quality standards. With great strides towards its objectives, CCH has expanded to become the largest healthcare system in central Taiwan. It consists of a medical center, 2 regional hospitals, 5 community hospitals, and 1 psychiatric hospital, and is continuing development by establishing Yuanlin Branch and CCH Logistics Center, Erlin Christian Hospital, Reverend Dr. William Xie Memorial Medical Building, Fumao Building, and the 7th building of the Medical Center, and Yuanlin Christian Nursing Home. With services covering the Zhanghua, Yunlin, Taichung, Nantou, and Taidong areas, the public enjoys easy access to quality medical care. The internal medicine, surgery, and pediatrics departments at CCH are subdivided into more than 60 specialty divisions. Additionally, CCH has built a health examination center with a comfortable interior. It established an international ambulatory clinic in 2007 and an international inpatient ward in 2008. With the most advanced medical equipment, comprehensive health services of the highest quality are guaranteed to the public. Our medical team unceasingly strives for patient-centered care and was accredited with the certifications of JCI CCPC, Joint Commission International Clinical Care Program Certification, in the areas of chronic kidney disease and diabetes mellitus in the year of 2010. The CCH is the first institution in the nation and the 4th in the world to pass the accreditation from CCPC. In 2012, the CCH continued to receive CCPC certifications for care provided in the area of strokes, adult asthma, HIV/AIDS, and chronic obstructive pulmonary disease, which totals 6 CCPC certifications so far. In the future, the CCH will continue to take up the challenge to reach even higher quality holistic medical care. The Department of Medical Imaging is equipped with a 3.0T MRI machine to provide faster examination speed, higher image resolution, and the best lesion detection rate. Recently, we introduced a dual-source, dual-energy computerized tomography system that is ultra-high in speed and low in radiation, which has a cloud platform for image processing and rapid analysis, and for processing large images. By using a super low dose of radiation, it can form clear images in a very short period of time, and is the perfect tool for diagnosing acute and severe cardiovascular disease. The CCH invested heavily in bringing in the world-leading surgical system in the domain of minimally invasive surgery, the Da Vinci surgical system. By integrating a 3D visual function, the system significantly enhances dexterity, precision, and control stability. It also provides an ergonomically relaxed operating environment and breakthrough functions for delicate surgeries. Therefore, the Da Vinci surgical system initiates another new era of high-quality surgery. In diabetes healthcare, CCH Long Distance Health Management Center combines information, communication technology, and an innovative internet service model to provide a long-term healthcare platform for chronic diabetic patients and control their health conditions simultaneously. The effectiveness of this service has been recognized by the government. We were honored with the Taiwan Long Distance Care Outstanding Contribution Award and designated by the Department of Health as the executive team for long-distance healthcare service in the Central Region. In 2012, our e-hospital further won the National Biotechnology and Medical Care Quality Bronze Award for quality diabetes care, and we became the benchmark hospital for long-distance healthcare service. In medical research, CCH has invested even greater efforts. In 2008, the Department of Genomic Medicine developed Asia's first chromosome detection chip, which is able to simultaneously test for over 1,000 heritable diseases. The chip won the Medical Innovation Award at the Taipei International Medical Exhibition in 2009. The Reproductive Medicine Center was certified by the Department of Health for artificial assisted reproduction. It specializes in the treatment of female infertility and offers the best available comprehensive medical services. Its IVF live birth rate has now reached 43%, one of the highest in the country. In collaboration with the Cell and Genetics Laboratory, the center also aims to develop pre-implantation genetic diagnostic procedures. The team at the CCH works diligently to provide medical treatment that is patient-centered, while upholding the 5 wholes principles: whole person, whole team, whole family, whole process, and whole community. Our holistic integration team includes doctors, nurses, pharmacists, social workers, physiotherapists, care counselors, dietitians, and other staff. When a patient comes to the CCH for medical help, our doctors and nurses will first proceed with a professional assessment. And if they think the patient's case requires the assistance of an interdisciplinary team, the holistic integration medical care will then be activated. Through meeting discussions, the team will set up a complete medical care plan that especially meets the needs of that specific patient, and the whole team will coordinate its efforts to provide consistent and thorough quality care. The medical plan will include care for the patient's body, mind, and spirituality, encouragement of family participation, treatment of the illness, healthcare education, and a preparation plan for discharging the patient. After the patient is discharged from the hospital, our community health center and home-based palliative care unit will also provide safe and heartfelt home care services if needed. Therefore, from admission to discharge from the hospital to return to the community, the patient will receive the most complete holistic treatment from our comprehensive medical team. In the spirit of Dr. Landsborough III, who traveled long journeys to bring medical evangelism to Taiwan, Zhonghua Christian Hospital also seeks to replicate his love for fellow mankind. Its overseas medical missions began in 2004 when it provided medical assistance to Papua New Guinea. In 2008 and 2009, it stationed medical teams in Swaziland and Sao Tome and Principe to provide long-term health care for local residents and to assist these fraternized countries in the establishment of healthcare systems. Since 2006, it has performed short-term medical services in St. Lucia, St. Vincent, Burma, Mongolia, Vietnam, Papua New Guinea, and Thailand. To enhance the medical standards of friendly countries, CCH has provided medical training to visiting medical staff from friendly countries since 2006, including Papua New Guinea, Swaziland, Sao Tome and Principe, St. Vincent, St. Lucia, Thailand, Indonesia, Mongolia, and Vietnam.
彰化基督教医院跟一般的医院不大相同，我们是服膺上帝的医院，我们以服事为心志，我们竭力为上帝做奴仆。我们也希望我们医院的员工及主管，大家能够继续往前走，来完成我们的5大任务：医疗、传道、服务、教育、研究。 我们希望在未来，彰化基督教医院能够成为台湾、亚洲甚至世界医疗的一个重镇。在精神方面，我们能够在传道方面能够发挥一些影响力。那期许在医疗传道方面，事事都能够容神益人。